short video is going to be covering the topic of intervertebral discs. The intervertebral discs or fiber cartilages are found in between each vertebrae throughout the spinal column, as you can see in this image here, with the exception of between the atlas and the axis. You also won't find them in the sacrum between the coccyx. The intervertebral discs are the chief bonds of connection between the vertebrae and make up about a fifth to a fourth of the height of the spinal column. They change in size and shape depending on where they're found, and they typically correspond with the surfaces of the bodies, except in the cervical area because of these uncinate processes that are found there. In the cervical and lumbar regions, because of our lordotic curves, they are slightly thicker anteriorly in those regions, and then through the thoracic region they are very uniform. So the intervertebral discs are made of three distinct tissues: the annulus fibrosus, which is the outsides of the disc; the nucleus pulposus, which is the center of the disc; and the vertebral end plates, which is a thin layer of hyaline cartilage which coats or encases the intervertebral discs with a thin layer in between the vertebral bodies and the discs themselves. The intervertebral discs contain mostly water throughout life, but they do dehydrate over time. So you can see approximately about 85 to 90% of water initially. This decreases to about 65% in the sixth decade. So over time it just decreases. Additionally, the disc has limited nerve supply. The outer edges of the intervertebral disc receive some nervous innervation. They also have some vascularity at the edges, but as you move into the disc, they become progressively less innervated and vascular, and as you reach the nucleus pulposus, it is essentially a non-point. So we are going to break down each of the three components of the disc and talk a little bit about why these matter. So first up is the annulus fibrosus, which is this outer layer. When I first started learning about these discs, my professor talked about these often as jelly donuts, and to this day I still think of that analogy when I think about the disc, and it holds fairly true. So this annulus fibrosus is the outer portion of the donut and serves to help contain this nucleus pulposus here on the inside. So with that in mind, the outer circumference of the annulus fibrosus of a disc is 10 to 20 concentric rings that are crisscrossed. They overlap. And that helps a disc maintain its shape and creates rigidity and structural integrity. However, that doesn't do much. So you can see here the innervation on the outside, the vasculature. It makes it very impermeable, this overlapping structure. But, it's a little bit of a trade-off because the arrangement of the annulus fibrosus increases its strength and ability to combine shear and torsional forces. So it's a little bit of a trade-off, and I think in this instance, the trade-off was preserved to help us have our motion. Importantly, the collagen of the annulus fibrosus merges into the cartilage of the end plate as it does with the nucleus pulposus, and you'll see why that's important in just a moment. So just a little bit more on this idea of the containment, or this outer layer which helps keeps the strength. So it allows us to, the annulus fibrosus allows us to maintain this movement. It's incompressible. It's very, very stable. And then those layers bind together the end plates because they are continuous with the end plates. So it becomes one solid continuous structure. As I've mentioned, the range of motion was the trade-off, but seems like a good a good trade-off in this instance. One important point about the annulus fibrosis, it does have minimal shock absorption because it is collagen fibers just layered and layered and layered. This portion of the disc is actually not the one that is good at allowing for a squish between these vertebral bodies. Moving on to the nucleus pulposus, the central portion of the disc. It's the jelly portion of the jelly donut, if you will. Loose collagen fibril network. At birth, a high portion of proteoglycans. If you've taken a chemistry class or a biochemistry class, you may recall that proteoglycans are really, really good at soaking up water. They soak up water really well. This causes the disc to resist deformation. However, these proteoglycans decrease with age and are replaced by collagen after the age of 20. So because the nucleus pulposus has all these proteoglycans, it is very good at soaking up water, and this is the part that helps us with our shock absorption, our transmission of forces, and our equalization of stress is the nucleus pulposus. Achieved through imbibition, so it holds up and takes fluid. This was an interesting stat. The nucleus can imbibe up to 3 times its weight. So I thought that was kind of interesting, and it kind of gives you a scope to how much, if you think of a sponge, your sponge is a certain weight, and as it soaks up water 3 times its weight, it holds a lot of water. The nucleus pulposus allows for the rocking action as it's a ball bearing. And then for nutrition, we're going to see this with the end plate. But the end plate, because I mentioned, out here on the periphery, we're going to have some vascularization and some innervation. But as we come in here, there's not going to be any of that. So the end plate will perform an important role to help provide some nutrition and fluid exchange, waste exchange, nutrient exchange here in the middle of the disc. So the last structure we're going to cover here is the vertebral end plate. Thin layers of hyaline cartilage which cover the superior and inferior surfaces of the vertebral bodies. The end plates, only the periphery of the disc is vascular, and this decreases with age, but the vertebral end plate helps us overcome that. It transports nutrients in and out of the disc by passive diffusions. You can see here it's approximately 1 millimeter thick, so it's not a lot, but it is a very important piece of the vertebral disc, intervertebral disc. When end plates fracture, the nucleus protrudes into the vertebral body and forms Schmorl's nodes. We have a picture here of a Schmorl's nodes, Scheuermann's kyphosis. This was a German guy. So you can see here the vertebral end plates would exist here on the ends. This is the bony skeleton, and these are the intervertebral discs. But you can see here that these intervertebral discs have a protrusion into the bony substance on either sides here. These are Schmorl's nodes. This pathology is usually in younger boys, more than girls. So, with that in mind, those vertebral end plates, they protect the bone, they permit fluid exchange, they perform a very important function, although they are not a large portion of the disc itself. Finally, 3 more slides here just on the idea of a slip disc or a prolapse disc or I don't know, whatever term, when someone throws their back out, whatever term you might hear, it's typically all contained in this idea of some type of a disc problem. So the thing that I want you to glean from this slide here is right here. In order for someone to have some type of a disc problem, so I'll come here to this slide. So here, the nucleus pulposus in this image has been stained blue. And the thing that I want you to see here is at this posterior lateral corner, the disc has protruded through the annulus fibrosus here into the periphery. So the thing that I want you to glean from this slide is the nucleus pulposus in and of itself would not have the fluid pressure maybe, or it doesn't contain within itself really the ability to overcome this annulus fibrosis. But if the annulus fibrosus has some type of a defect within it, then that nucleus pulposus will exploit it. A little bit like a crack in the road during winter. If the road doesn't have any cracks in it, the water and the snow as it goes down, it can't exploit it and it just runs off to the sides. However, if there's a crack in the road, as the water comes in, it gets in the crack and then it freezes and it expands. Kind of like that similar idea. If there's a defect in the annulus fibrosus, the nucleus pulposus can infiltrate, and then it, with increased pressure, I keep using my hands to push back this way. With increased pressure, it's going to create problems in the annulus fibrosus and then potentially have some type of a prolapse or a protrusion of that nucleus pulposus into the annulus fibrosus and potentially into the nerve roots. So an important point here, the nucleus usually cannot exit straight posteriorly, straight through the back, because the PLL, the posterior longitude ligament, pushes against it. The nucleus gets deviated in a posterior lateral direction where no ligament pushes back. So most disc herniations occur posterior laterally out to one side. And if you know somebody, chances are you know somebody with some type of a disc problem, that it's generally one-sided and it can come back fairly frequently. So last slide here, just to show that over time, these discs lose their structural integrity. So this is in a younger person, and this is in a relatively older person. So the thing that I want you to see here, look at the water content, look at the smoothness of this, and then when you compare it with this picture here, just notice how it's more fibrotic, it's more dehydrated. You could see how the disc just begins to degenerate. The other thing is it becomes a little off-colored, a little brown here as a result of the non-enzymatic glycation. So just over time, the disc itself begins to break down. And that finishes this video on the intervertebral discs.